glad you're with us today. It's a vital part of your child's health. February is National Children's Dental Health Month.
And we have Matt Pelais and Tyler Bolin, the owners of Commonwealth Dentistry, here to tell us more. Both of them general dentists. Thanks for coming. We appreciate it very much.
Absolutely. Thanks for having us.
Thank you very much.
So when should a child start to see the dentist?
Yeah, that's a great question. We typically say as soon as your children have teeth, then that's an appropriate time. 1 year of age is a pretty appropriate time. That appointment's a lot of times just for parent education, make sure that some things are taking place at home that we can care for those teeth as they come in and to develop.
So to begin that care process, I mean,
Yes,
even as you said, it's an educational process even for the parents.
Yeah.
Is that important that you have good communications with the parents when the child comes in?
Absolutely. That's probably one of the most important parts of that first visit of bringing your child to the dentist. We just want to educate the patients and the parents and make sure they know what's going on, what to expect, and things that they can be doing at home to set their child up to have a healthy mouth and healthy teeth.
Well, and dental care has certainly changed. I know a lot of times now sealants are the way to go. What are those?
Sure, those are protective covers that we put on the teeth. We typically reserve those for the permanent teeth, the molars in the very back. Those typically come in when your child's about age 6, and this is a way for us to prevent those teeth from needing fillings in the future. It's just a real thin layer of pretty much plastic that kind of protects that tooth.
I can only imagine in doing your job, you want to be sure that the kids are as relaxed as they can be. What would you have parents maybe tell the children about their visit to the dentist before they get there?
Yeah, I mean, so our goal is just when we bring our patients in and the little children, we like to make it so that it's just a comfortable, friendly environment. And really those first appointments is just getting you used to coming and seeing what we're about and that we're not a scary place and we're just a place that we just want to talk to you and have a good time. I mean, we do whatever we can to make children feel comfortable and we want them just to come to us, know that it's not a scary place. I think what's important too is a lot of parents not to use things like, we're going to take you to the dentist if we don't brush your teeth.
Right.
You're going to have all these cavities if you don't brush your teeth.
No threats out there.
Right. So just trying to keep it a positive, happy environment because that's what we like to present and that's what we want to do. I mean, we just want to have a good time. We're excited to see children and see parents and families.
Well, do you think it makes it easier when the whole family goes together, when they know that that's the place to be?
Yeah, I think it definitely does. Seeing older brother sit in the chair and, you have the 3-year-old watching the brother and they're getting their teeth brushed. And this isn't a big scary thing. Like, we just want to look at your teeth and count them. And that's the biggest thing, desensitizing them at a young age so that the first time they come in, it's not 6, 7, 8 years old and then they don't know what's going on.
Be sure they don't get in a bragging contest about who had the most cavities.
That's right. Yeah, that's right.
No cavities. That's a thing of the past. No cavities.
That's right.
Where are you all
Commonwealth
located?
Dentistry.
We're located on the Meyer off of Reynolds Road. So right
Very
across
good.
the street from Fayette Mall.
Appreciate you coming in, guys.
Thank y'all
guys.
for having us. Appreciate it.